Professional communications. Because the role of the pharmacist has transitioned from a task-centered practice to a patient-centered practice, effective communication skills are essential for providing patient care. The pharmacist must develop a trusting relationship with the patient that is based on open communication, cooperation, and mutual decision-making, which will lead to a partnership with a common goal of improving health outcomes. Communication between health professionals and patients serves two functions. It establishes an ongoing relationship between the provider and patient. It provides an exchange of information that will allow the health professional to assess a patient's health condition, manage treatment, and evaluate effects on quality of life. An effective relationship allows the pharmacist to help the patient meet the mutually agreed on health outcomes that improve a patient's quality of life. The goal is not to get the patient to do as he or she is told, but to help the patient reach the intended outcomes. Communication is a means of reaching an outcome, rather than the end itself. 23.1 Components of interpersonal communication. Interpersonal communication involves generation of a message by an individual, transmission of the message from one individual to another, reception of the message, interpretation of the message. The message can be information, ideas, thoughts, emotions, and so on. The sender can transmit the message through oral, talking, nonverbal, using body posture, hand movements, facial expressions, etc., and written forms. The receiver interprets the message and assigns a meaning to it. Numerous barriers exist in the pharmacy setting and can affect interpersonal communication. They include but are not limited to the following: environmental barriers, pharmacy counter, noise, crowds, lack of privacy. Personal, low self-confidence, shyness, internal monologue, lack of objectivity. Cultural differences. Patient barriers, inaccurate perception of the pharmacist's role, the healthcare system, or the patient's medical condition. Administrative and financial barriers, high prescription volume, few support staff members, staff members not paid to talk. Lack of time. Feedback is a process by which the receiver can communicate his or her understanding of the message back to the sender. The original sender now becomes the receiver of the feedback or message. Feedback can mean giving a simple nonverbal gesture or asking the patient to repeat back a complex set of instructions. Pharmacists can use feedback to ensure that the correct meaning of the message was interpreted. 23.2 Health literacy. According to Healthy People 2010, www.healthypeople.gov/right/, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. One study of health literacy found that 42% of patients could not read and comprehend directions for administering a medication on an empty stomach. Low health literacy can affect people from all ages, races, and income and education levels. Many patients who have low literacy levels, approximately half of Medicare and Medicaid recipients read below the 5th grade level, may try to hide the problem from their healthcare provider because they are too ashamed or intimidated to ask for help. Vulnerable populations include the following: elderly people, age 65 or older; minority populations; immigrant populations; low-income individuals; people with chronic mental or physical health conditions. The United States Pharmacopoeia, USP, has created the USP Pictogram Library, which includes 81 pictograms that can be used to illustrate medication instructions and precautions. Pharmacists should seek to identify patients with low health literacy, reassure these patients that they should not be ashamed, and develop appropriate visual or written materials. 23.3 Interviewing techniques. The patient interview allows the pharmacist to obtain patient-specific information, which will help the pharmacist formulate a therapeutic plan, enhance patient satisfaction, and provide better patient care. Effective interviewing is a learned skill. The following are key points to consider when interviewing a patient. When opening the interview, always introduce yourself and state the purpose of the interview. Ask if it is okay to talk in front of others, family members, friends, etc. Try to appear professional, interested, confident, and relaxed to put the patient at ease during the interview. Establish and maintain a rapport with the patient by being personal. Take notes, but do not lose focus on the patient. Control the flow of information by asking only one question at a time. Politely redirect the patient to the line of questioning if he or she veers off topic. Give the patient ample time to recall information. Gently prod, but do not waste time if the patient cannot remember. The use of open-ended questions is very helpful when gathering patient information. Open-ended questions are phrased in a manner that cannot be answered by a yes or a no. An example of an open-ended question is, "How did the doctor tell you to take this medication?" This type of question requires the patient to provide much more information than just a yes or a no. In contrast, the closed-ended question, "Did the doctor tell you how to take this medication?" can be answered with a yes or a no. When closing the interview, summarize to the patient the information you have gathered and explain the plan. Ask the patient if he or she has any questions. Following are several types of interviews that pharmacists routinely conduct and the questions used in each type. Problem-focused interview. The problem-focused interview is used to gather information from a patient who has a health complaint such as chest pain, shortness of breath, or headache. It allows the pharmacist to determine if the complaint can be treated by non-prescription therapy or if the patient should be referred to another healthcare provider such as a physician. The problem-focused interview should be conducted as follows. First, ask an open-ended question, "What can I do for you today?" or "How may I help you?" Second, make an open-ended statement, "Tell me more about it." Third, provide a partial summary. Repeat back to the patient what he or she just told you. Then move to the following basic 7 questions. 1. Location. Where is the symptom? 2. Quality. What is it like, or describe it to me? 3. Severity. How bad is it, or how does it interfere with your life? 4. Timing. How long has it been present, or when did it start, and how often does it occur? 5. Selling. How did it happen, or what were you doing when it occurred? 6. Modifying factors. What makes it better, and what makes it worse? 7. Associated symptoms. What other things have you noticed? Finally, summarize what the patient has said. Let me see if I have this right. Repeat back to the patient what he or she just said. Medication history. Obtaining an accurate medication history is a vital skill that the pharmacist must employ. A medication history is much more than a list of medications the patient is taking. It includes allergies, past medications, adverse reactions, and over-the-counter, OTC, medications. A comprehensive medication history should be conducted as follows. Allergies. What, when, where, outcomes. Current prescription medications. Drug name, purpose, dose and frequency, duration, assessment of effects. Past medication usage. Drug name, purpose, time period of use, reason for discontinuation. Adverse drug reactions. What, when, where, outcomes. Use of OTC drugs, herbal products, and vitamins. Drug name, purpose, dose and frequency, duration, assessment of effects. Other substances, tobacco, alcohol, illicit drugs. Amount, frequency, duration. Adherence. Missed doses, reasons for non-adherence. Patient counseling. Pharmacists are expected to counsel patients on the use of prescription medications. The Indian Health Service has developed a series of open-ended questions that elicits information the patient already has about his or her medications so the pharmacist can focus his or her efforts on providing information the patient does not already have or correcting any misconceptions the patient may have about his or her medications. These questions, called the 3 prime questions, are listed below along with the information each question is designed to cover. What did the doctor tell you the medicine is for? Name of medication, purpose of medication. How did the doctor tell you to take the medication? Dosing schedule, additional instructions, length of therapy, storage. What did the doctor tell you to expect? Expected outcomes, precautions, possible side effects. 23.4 Active listening and empathy. Active listening is a crucial component in professional communication. Whether one is gathering information from a patient regarding an adverse drug reaction or taking a drug information request from another healthcare professional, listening is vital to the communication process. Listening is an active process. It first involves the act of will. An individual must be willing to listen. Next, listening requires complete and undivided attention. In addition, the effective listener does not judge or evaluate the communication, problem, or feelings of the other person. This is not to say the pharmacist does not evaluate a clinical issue pertaining to the patient. However, if practicing active listening and empathy, the pharmacist will not evaluate the character of a person on the basis of the merits of the clinical issue. Following are tips for effective listening. Stop talking. Get rid of distractions. Establish appropriate eye contact. Read nonverbal cues. Listen to how something is said. Provide feedback. Empathetic responding is a byproduct of active listening. Empathy means that one actually shares the experience of another. To be empathetic, one must identify with the affective experience of another. By communicating to patients that he or she understands their feelings, which are a result of a particular experience, the pharmacist is able to establish a caring, trusting relationship. Active listening and empathetic responding are the foundations of the pharmacist-patient relationship. 23.5 Assertiveness and problem-solving techniques. Assertiveness is the direct expression of ideas, opinions, and desires. The pharmacist needs to behave assertively in a variety of settings, whether dealing with patients, other health care providers, administrators, or technicians. Assertiveness is not to be confused with aggressiveness. Aggressive behavior seeks to win in a conflict. Aggressive behavior does not respect the rights of others and often interrupts or dominates a conversation. Assertive behavior can be characterized by directly expressing ideas, opinions, and desires, showing respect for self and others, being willing to openly and honestly communicate feelings, opinions, and needs, not violating the rights of others. Several problem-solving techniques have been identified to aid the pharmacist when interacting with individuals in a difficult situation. Each of these techniques is described here with an example. Fogging. Acknowledging possible truth from someone while ignoring any implied judgments about oneself. Patient, $90. That is outrageous. You're trying to rip me off. Pharmacist, yes, this is an expensive medication. If you would like, I can call your doctor and discuss some less expensive alternatives. Being a broken record. Using calm repetition. Patient, the doctor wrote this, you have to fill it. Pharmacist, I cannot fill this prescription as it is written. Repeated over and over. Using negative inquiry. Actively prompting feedback to use the information while prompting the critic to be more assertive and less dependent on manipulative ploys. Patient, that is impossible. I can't give myself an insulin shot. Pharmacist, what is it about giving yourself an insulin shot that bothers you? Sorting issues. Separating several issues that are sandwiched together. Patient, why didn't you tell me he had cancer? We all play golf together. I thought we shared everything. Pharmacist, we do share many things as golfing friends, but I am also his pharmacist. And as a pharmacist, I owe him confidentiality. Disarming anger. Offering an honest contract to someone who is exhibiting a lot of anger, writing it down is often helpful. Patient, you gave me the wrong prescription. How could you do this? Do you know what I would have done to you if I would have taken the wrong medicine? Pharmacist, I didn't realize that an error occurred. Please start from the beginning. And I will write down all of the details. Selectively ignoring. Discriminatory attendance or non-attendance to specific content from another individual. Patient, I'm not sure I can take this medication correctly without some further instructions. Let's have dinner tonight and we can talk about this some more. Pharmacist, I can explain the instructions to you now. What confuses you? 23.6 Cultural influences on communication of health information. Because of the cultural diversity of the United States, pharmacists must be aware of their own culturally determined values and behaviors and be aware of other cultures. Culture is defined as a complex pattern of shared meanings, beliefs, and behaviors that are learned and acquired by a group of people during the course of history. Culture can influence how people view others who are different. Because of the interactive role the pharmacist has with the patient, the healthcare team, and the community, pharmacists must strive to avoid certain negative viewpoints of other cultures. Ethnocentrism is the belief that one's own culture is superior while expressing contempt for another culture. Prejudice is a preconceived judgment or opinion of another person that is based on direct or indirect experiences. Stereotypes are fixed perceptions of a particular group or culture that reject the existence of individuality within that group or culture. These biases can hamper the pharmacist's ability to obtain vital patient information and reach an accurate assessment of the patient. Pharmacists should also be aware of how different cultures may interpret their communication. Conversation style varies from culture to culture. Some groups may prefer a more direct and to-the-point style, whereas others may prefer a more indirect style with an abundant amount of words. Health beliefs, family relationships, and communication style vary from culture to culture. To promote more effective communication, pharmacists should seek to identify these cultural differences in the patient population they serve and the healthcare professionals they work with. 23.7 Group presentation skills. Pharmacists are frequently asked to present drug information in a small group setting. These groups may consist of laypersons with a particular disease, such as diabetes, a group of nurses who need to learn how to administer a new medication, a group of physicians requesting prescribing information for a complex medication, or a group of high school students interested in becoming pharmacists. Before preparing the presentation, the pharmacist should assess the knowledge level of the group and design a presentation that is based on that assessment. For a group of lay people, the effective presenter would avoid the use of jargon and speak in easy-to-understand lay terms. For a group of physicians, the pharmacist would prepare a presentation with up-to-date scientific evidence attesting to the validity of the information presented. Time constraints should also be considered. Attempting to provide a large amount of material in a short time frame will only confuse and overwhelm the audience. The use of audio-visual aids can help enhance the overall effectiveness of the presentation but should not be a distraction. If appropriate, the pharmacist should involve the audience by asking questions to the group to encourage participation. Studies have shown that participants in an interactive presentation retain more information than do passive listeners. Allowing time for and encouraging questions from the audience at the end of the presentation is also important. 23.8 Documentation of pharmacists' recommendations and consultations. Pharmacists document patient care activities for numerous reasons, such as the following: to organize thought processes, to provide continuity of care, to obtain reimbursement, to meet accreditation and quality assurance, Joint Commission on Accreditation of Healthcare Organizations, state requirements, to meet legal requirements, Omnibus Budget Reconciliation Act, state laws, to deal with litigation concerns, to reinforce and create roles for pharmacists. The most common and universally recognized format for documenting patient information is the SOAP, subjective, objective, assessment, and plan. Note: subjective. The subjective portion contains information provided by the patient or the patient's caregivers. It includes complaints or symptoms reported by the patient. In his or her own words, chief complaint, a recent history that pertains to those symptoms, history of present illness, the patient's past medical history, the home medication history, allergies, the patient's social and family history, and a review of symptoms. Objective. The objective portion contains data obtained from the patient that can be measured objectively. Such information includes vital signs, physical findings or physical examination results, laboratory test results, serum drug concentrations, diagnostic test results, and a computerized medication profile. Assessment. The assessment portion contains a record of the pharmacist's critical thinking and analysis. It is based on the information available in the subjective and objective portions of the note. If a new problem is identified, adding newly identified is common. Likewise, for existing problems, adding worsened, stable, or resolved is common. Many times, the rationale for the assessment includes published guidelines and recent literature. Plan. The plan portion contains the actions that were or will be taken to resolve the identified problems. The pharmacist should be detailed in recommendations involving drug therapy. He or she should provide the medication name, dose, route, frequency, and duration. Included in the plan is the follow-up necessary to ensure the problem is resolved. This follow-up includes monitoring parameters and the interval for the next assessment. Patient records should always include the date and time of the documentation. The pharmacist should sign his or her name at the end of the SOAP note. Using medical terms is customary when documenting patient care. When writing in the medical record, the pharmacist should be sensitive, accurate, and brief. Do not place blame or state a cause and effect relationship. Be aware of litigation, because the patient record is a legal document. 23.9 Principles of Behavior Modification. Adhering to a new medication regimen often requires behavior change. For many patients, starting a new medication regimen can be as difficult as beginning a new exercise program, changing their diet, or ceasing smoking. The more complex the medication regimen, the more difficult the change may be. The goal of the pharmacist is not to force change but to assist patients in moving from being ambivalent to having the will to change. The theoretical model of change describes change as a process that occurs over time. The stages of the model are described in the following subsections. Stage 1, Pre-contemplation. In this stage, people are not intending to take action in the future, which is usually measured as the next 6 months. People may be in this stage because they are uninformed about the consequences of their behavior. Interventions by the pharmacist at this stage should focus on non-judgmental advice and information to patients considering change. Stage 2, Contemplation. In this stage, people are thinking about changing and intending to change in the next 6 months. They are aware of the benefits of changing but also see the challenges or costs associated with the change. Interventions during this stage should aim at encouraging the patient to verbalize the benefits of change and ways to overcome the barriers to change. Stage 3, Preparation. In this stage, people are intending to take action in the immediate future, which is usually measured as the next month. These individuals have made a conscious decision to take action toward change. Pharmacists can assist patients in this stage by providing specific strategies for success. Stage 4, Action. In this stage, people have made specific overt modifications in their lifestyles within the past 6 months. Relapse is common at this stage. Continued positive reinforcement is critical to help prevent major relapses. Stage 5, Maintenance. In the maintenance stage, people are working to prevent relapse, but they do not apply change processes as frequently as do people in action. They are less tempted to relapse and increasingly more confident that they can continue their change. 23.10 Key Points. Key components of interpersonal communication are the sender, the receiver, and the message. Pharmacists should identify barriers to communication and seek to resolve those barriers. Pharmacists should identify patients with low literacy skills and develop appropriate visual or written materials. Open-ended questions will provide the pharmacist with more information than traditional closed-ended questions. The problem-focused interview is used to gather information regarding the chief complaint and will help to determine the course of treatment. A medication history includes allergies, current and past medications, adverse actions, over-the-counter medications, and adherence. Using the 3 prime questions for patient counseling allows the pharmacist to focus on medication information that the patient does not already have. Active listening and empathetic responding are the foundations of the pharmacist-patient relationship. Employing assertiveness when dealing with a difficult situation will help the pharmacist to maintain open lines of communication. Pharmacists must be aware of their own culturally determined values and behaviors, and those of other cultures. Documenting pharmacist activities is a critical step in providing patient care, both for dealing with potential litigation concerns and for reinforcing roles for pharmacist-provided patient care. The SOAP note is a common format for documenting patient care. By assessing a patient's progression through the stages of behavior modification, the pharmacist can assist in improving medication adherence. 23.11 Questions. 1. Which of the following is the best description of feedback? A. The pharmacist asks a patient, "Do you understand what I'm saying?" B. The pharmacist tells the patient, "I understand what you are trying to say." C. The receiver repeats back to the sender the former's understanding of the message. D. Feedback is a typical technique that is used in everyday interactions. 2. Acknowledging possible truth from someone while ignoring any implied judgments. About you describes which of the following assertive skills? A. Sorting issues. B. Negative inquiry. C. Disarming anger. D. Fogging. 3. What information should be covered through the first prime question during patient counseling? A. Dosing schedule. B. Storage recommendations. C. Purpose of the medication. D. Possible side effects. 4. What information should be covered through the second prime question during patient counseling? A. Name of the medication. B. Expected outcomes. C. Possible side effects. D. Dosing instructions. 5. What information should be covered through the third prime question during patient counseling? A. Purpose of the medication. B. Storage recommendations. C. Possible side effects. D. Length of therapy. 6. Generally, which keyword should be used to ask an open-ended question? A. Can. B. How. C. Will. D. Did. 7. In general, which keyword would not allow you to ask an open-ended question during a patient interview? A. Do. B. How. C. When. D. What. 8. A patient approaches your pharmacy counter and states that she has a headache and would like to purchase something to relieve it. To perform a problem-focused interview and find out more details about the headache so that you can make an appropriate recommendation, you should obtain what information? A. Pattern, timing, reasoning, drug effects, other disease states, and repeated symptoms. B. Location, quality, severity, timing, setting, modifying factors, and associated symptoms. C. Location, timing, pattern, family history, social history, and surgical history. D. History of present illness, past medical history, allergies, timing / and associated symptoms. 9. When inquiring about the quality of the headache, which is the most appropriate question to ask? A. Is your head pounding? B. What is it like? C. Does it feel like a big vice grip is on your head? D. How bad is it? 10. When inquiring about the timing of the patient's headache, which is the most appropriate question to ask? A. Did it start while you were studying for tests in pharmacy school? B. How long has it been present?